Let me ask you an important question. If a medical test exists, does that automatically mean it is good for you? Most people over 70 believe that more tests mean better health. But as a doctor who has worked with older patients for decades, I can tell you something most hospitals will not say out loud. Some routine health checkups after 70 can actually cause more harm than benefit. They can lead to unnecessary stress, false alarms, invasive treatments, side effects, and even reduced quality of life. Today, I'm not here to scare you, I'm here to protect you. In this video, I'll explain 5 common health checkups you should seriously reconsider after age 70, why doctors are now questioning them, and what smarter alternatives you should focus on instead. So please watch carefully, because this information could save you from unnecessary pain, fear, and medical harm. When people reach their 70s, something very important changes in medicine, although it is rarely explained clearly. The goal of healthcare slowly shifts. In younger years, the focus is on finding problems as early as possible, chasing every abnormal number and fixing everything aggressively. After 70, the true goal should be very different. It should be about protecting quality of life, preserving independence, reducing unnecessary suffering, and avoiding harm. As a doctor who has seen thousands of older patients, I want to speak honestly and calmly about something that may surprise you. Not every health checkup that sounds responsible is actually helpful at this age. In fact, some common checkups can quietly cause more harm than good, leading to anxiety, unnecessary procedures, complications, and loss of peace of mind. This is not about avoiding doctors or ignoring symptoms. This is about understanding when medicine helps and when it oversteps. Many older adults believe that doing more tests means they are being careful. They feel reassured by frequent scans, repeated blood work, and routine screenings. Families often encourage this, believing they are protecting their loved ones. But medicine does not work on intention alone. It works on evidence, balance, and understanding risk. After 70, the body responds differently. Healing is slower, side effects are stronger, and the margin for error becomes smaller. A test that offers benefit at 50 may offer very little at 75, while still carrying the same risks. One of the most common examples is routine full-body scans or so-called comprehensive health scans. These are often marketed as advanced, preventive, and life-saving. They promise peace of mind by looking at everything at once. In reality, they frequently do the opposite. The aging body naturally shows changes on imaging. Small cysts, nodules, calcifications, and structural changes are extremely common and usually harmless. When these are discovered, they are labeled as abnormal, even when they pose no real threat. This leads to more scans, biopsies, and sometimes surgery. Each step adds risk. Radiation exposure accumulates. Invasive procedures can cause bleeding, infection, or prolonged recovery. The emotional toll should not be underestimated either. I have seen patients lose sleep, appetite, and joy while worrying about findings that never would have affected their lives. At this age, discovering something does not always mean it needs to be treated, and treating it can sometimes cause more damage than leaving it alone. Another area that deserves careful thought is aggressive cancer screening without symptoms. Cancer is a frightening word, and fear drives many decisions. However, not all cancers behave the same way, especially in older adults. Some cancers grow so slowly that they will never cause problems during a person's natural lifespan. Detecting these cancers can lead to treatments that are far more harmful than the disease itself. Surgery, radiation, and chemotherapy can weaken the body, impair mobility, affect continence, and reduce independence. Recovery can take months or may never fully happen. The idea that every cancer must be found and treated immediately is outdated, especially after 70. Screening should be individualized, based on overall health, functional ability, and personal values. The most important question is not, can we find something? But, will finding this improve your life? Heart-related testing is another area where overuse can quietly harm older adults. Routine stress tests, advanced heart scans, or repeated cardiac imaging are often done even when there are no symptoms. The aging heart can show changes that look concerning on tests but are stable and harmless. False positives are common. Once a test suggests a problem, it sets off a chain reaction of more tests and invasive procedures. Angiograms, stents, and hospital admissions carry real risks after 70, including kidney injury, bleeding, infections, and prolonged weakness. If a person feels well, walks comfortably, and has no chest pain or shortness of breath, aggressive heart testing rarely improves outcomes. Managing blood pressure, staying active, eating well, and addressing symptoms if they arise is often far safer and more effective. Bone density testing is another example where good intentions can turn into unnecessary worry. Bone density scans are useful tools, but repeating them too frequently in older age often does not change management. A slight change in numbers may prompt stronger medications, which can have side effects affecting digestion, jaw health, or muscle pain. What truly prevents fractures in older adults is not chasing numbers on a scan, but improving balance, strengthening muscles, ensuring adequate vitamin intake, and preventing falls. Focusing too heavily on test results can distract from what actually keeps bones safe in daily life. Routine blood tests are perhaps the most misunderstood area of all. Many older adults undergo frequent blood work to keep every value within a normal range. What is rarely explained is that normal ranges are often based on younger populations. Mild abnormalities in older adults are common and often harmless. Treating every slight deviation can lead to multiple medications, each with its own side effects. Dizziness, confusion, fatigue, and falls are frequently caused not by disease, but by over-medication. Adding pills to fix numbers without considering how the person feels can reduce quality of life significantly. Medicine should treat people, not just lab reports. The deeper issue behind all of this is the belief that more medicine automatically means better care. After 70, the opposite is often true. The best care is thoughtful, selective, and focused on what truly matters to the individual. This includes mobility, mental clarity, emotional well-being, social connection, and the ability to enjoy daily life. Excessive testing can shift attention away from these priorities and turn a healthy older person into a patient who feels fragile and unwell. It is important to understand that avoiding unnecessary checkups does not mean ignoring symptoms. Any new pain, unexplained weight loss, bleeding, shortness of breath, or sudden changes in function should always be evaluated. The key difference is responding to symptoms rather than searching endlessly for problems that may never cause harm. This approach respects the body's natural aging process while still protecting health. Conversations with doctors should change after 70. Instead of automatically agreeing to every test, it is reasonable to ask simple, powerful questions. Will this test change what we do? Will it improve daily life or independence? What are the risks if we do it? And what are the risks if we do not? These questions lead to better decisions and more personalized care. Good medicine at this stage of life is a partnership, not a checklist. Families also play an important role. Loved ones often push for more testing out of fear and love, but reassurance does not always come from more information. Sometimes it comes from understanding that doing less can actually protect health. Supporting an older adult means helping them stay active, engaged, safe, and comfortable, not just ensuring they attend every appointment and test. As a doctor, I have seen patients thrive when unnecessary medical burdens are lifted. They walk more, sleep better, worry less, and feel more in control of their lives. I have also seen the opposite, where excessive testing turns healthy aging into a constant cycle of appointments, procedures, and fear. The difference lies in choosing wisely. Aging is not a disease. It is a natural stage of life that deserves respect, not constant medicalization. The purpose of healthcare after 70 should be to add life to years, not just years to life. When tests support that goal, they are valuable. When they undermine it, they should be questioned. The most powerful medicine at this age is not always found in a lab or a scanner. It is found in movement, connection, purpose, and peace of mind. Protect those carefully, because once they are lost, no test can bring them back. Choose care that supports your life, not care that quietly takes it over. Let me leave you with this important message. Good healthcare after 70 is not about doing more tests. It's about doing the right things. Avoiding unnecessary checkups does not mean neglecting your health. It means choosing wisdom over fear, quality over quantity, and well-being over worry. Always talk openly with your doctor. Ask, will this test change my treatment? Will it improve my quality of life? Do the benefits truly outweigh the risks? Your body has served you for decades. Now it deserves care that is gentle, thoughtful, and respectful. Thank you for watching.